here today to give you guys a surgery update. Yay! Alexis is in this video because she won't get down. Down. Okay. Alright, so I went last week and had a CT scan done on Friday. It was a pre-surgery CT scan, so it was just supposed to be a scan so that the doctor could plan how he was going to do my surgery. And then I got some information back last night through my patient portal from the doctor, and it was the results of my CT scan. So basically, in the results, it said that I have something called acetabular retroversion. And I don't know if I'm saying that right, but I'll put it at the bottom of the screen so you guys can see the spelling of it. So acetabular retroversion, which is basically a hip dysplasia that you're born with. So from what I understand, I don't really know much about it. I've just kind of Googled it and researched it. I haven't actually talked to my doctor about it. But from what I'm seeing, it looks like the socket of your hip that the bone goes in is facing the back instead of where it's supposed to be facing. It's facing towards the back. So your bone rubs up against it all the time, and it can cause damage to both of those bones. It can cause labral tears. It can cause irritation of the tissue in between because of it rubbing back and forth all the time. So that's not great news. It's not good news, actually. And from what it turns out, it's also in my left hip. So I have the same dysplasia in both hips, it looks like, from what the doctor has said. So as far as I know right now, the surgery is going to be planned the same way. With the hip dysplasia, what they'll be doing, I guess, is seeing if they can fix it while they're in there. They're not exactly going to know if they can or how they're going to fix it until they actually get in there doing the surgery. So at this moment, things are still kind of unknown, and they're going to be unknown until my surgery. What I'm hoping is that I'm hoping they can fix it. What I do know is that most likely I'm going to have the same thing done on my left hip at some point in the future. You can't do both at the same time, but at some point in the future I'll have to have the left hip done as well. So I'm kind of sad about that, but at least I have a few more answers here. Hoping that they can fix the dysplasia and that I don't have to have any sort of hip replacement or joint replacement. That would be worst case scenario. I'll go to sleep and wake up and hey, you have a new hip. Don't really want that to happen. I'm only 22, so it just feels like I'm 80, but you know, things happen and we get through them in life. Okay, so I feel like I'm talking really fast, so we'll just put this out there again. Okay, so my surgery is on June 25th, and that's next Thursday, so a week from today. I'm having surgery on my right hip. Mommy's doing the video, okay? The surgery is going to be to remove this mass that I have in my right hip in the joint. They think is some sort of synovitis. One doctor thought that it was pigmented villonodular synovitis, which is a very rare type of synovitis. Another doctor thought it was just a different type of synovitis, but he wasn't sure. And synovitis is just basically inflammation of the tissues. The pigmented villonodular synovitis is a rare type that you can't really get rid of. You can address, but it's going to keep coming back. So we're not exactly sure which one that I have. They won't know until they get in there. They also think that I have a labral tear in that hip. So they will be repairing the tear when they go in there as well. I did not know that I had hip dysplasia, and dysplasia is something that you're born with. It's just how my hips are, how I was born. They're not shaped the way that they were supposed to be. They're not put together the way they were supposed to be. So now that we know that I have the dysplasia, that adds another thing to the list of things that have to be done during my surgery. So they'll be addressing that and trying to fix that, as well as everything else that they already knew about. So it's a little complicated. So I'll show you guys some of the equipment that they gave me today. I had to go get fitted for a brace and for a machine that I'm going to have to use, a continuous motion machine that I'll have to use after my surgery. My healing time, I do not know what my healing time is going to be because I don't know exactly what they're going to have to do when they get in my hip. They will know after they get in there how long my healing time is going to take. So they're thinking somewhere around 6 weeks, I believe. I might be able to go back to work sooner than that. It might be after that. I don't know. It's just going to depend on what we have to do exactly. So I'll show you guys some of the equipment that they gave me today. It's pretty great. Okay. So first I'll show you the brace that they gave me. This is what I'm going to have to wear immediately after my surgery for about 3 to 4 weeks. I have to wear this thing 24/7, even when I'm sleeping. So I have to put this right here above my hip bone and then wrap this around here and put it together. And then I have to wrap this around the back of my leg here and hook it. And to tighten it, there's some Velcro here that you pull on and tighten, and then there's also Velcro in the back that you pull on and tighten. Okay, so it's hooked up there, and right now it is on the unlocked motion, so I can sit down with it. It lets me move at a 90-degree angle. It does not let me move side to side. So I wear this all day long, you know, all the time, and I can have it unlocked when I'm walking, or I can lock it so that I don't risk doing anything, but most of the time I'll have it unlocked. But I'll press this button down, and I have to be standing straight up, press it down, and that locks it. And I have to wear it locked while I'm sleeping so that I don't move all of a sudden and hurt myself. So this doesn't let me move at all. It doesn't let me sit or move side to side or anything. It's completely locked like this. So that is the beautiful thing I've got to wear after my surgery. All right, and this beautiful thing is the continuous motion machine that I have to use after my surgery. I have to wear this thing 4 to 6 hours a day for about 4 weeks after my surgery. So you're supposed to put your foot in this, strap it in, put your leg in here. Your knee is supposed to line up right here where this little separation is. And then I'm supposed to take this and wrap this around my thigh like so. And then I take this and set the settings to it. So it's going to basically move my leg up and down extremely slowly. It goes very slow, but it's just really supposed to help me from getting stiff in the area. And so I'm supposed to use this. I'm going to use it a lot. I didn't plug it in. I'm not going to turn it on because it really is like super slow. So it's hard to tell, but the guy said that some people sleep in this. And it looks huge, but honestly, it probably wouldn't be that difficult to sleep in because it's, you know, it's pretty comfortable and it's stationary. And I feel like it would help you not to be stiff in the morning because you would have been moving all night, so that joint wouldn't be stiff. So that's pretty much it. My surgery is set for next Thursday, and I'm doing this. I'm not going to have really any more answers until it's done. I'm dreading it, but I'm kind of looking forward to it because I just want to get it addressed and get it over with. But I'll give you guys updates as I know updates. And after my surgery, I'll try to give you guys an update as soon as possible and let you know how I'm doing and how it went and what the results were. It's going to be interesting to see. I've had hip problems my whole life. You know, like I said before, I always had like hip pain when I played sports or when I was standing for a long time, sitting for a long time, those certain things. It would always be kind of painful at a certain point. And then like last year is when I had the episode where I couldn't walk for a long time. It just got so much worse, and that was because of the inflamed tissue, the synovitis that I have, and probably also the labral tear if I have a labral tear. We're not certain. So it's just nice to know, I guess, now that there may be a reason behind it, and it could just be this dysplasia that I've had since I was born, and that would be the reason why I've had all the problems that I've had. I'll let you guys know what the doctor says about my left hip, when he recommends treating, if he recommends treating preemptively. I still have pain with that hip. It's just not as bad as the right hip. So we'll see. Right now, I guess let's deal with the right side first. First things first. Get that over with and see how that goes. I'm really hoping and praying it goes well. I want to ask you guys if you could just send a prayer out for me, and I would really appreciate that. I could use all the prayers I could get. I'll give you guys an update as soon as possible. Only a week to go. Have a good one, guys. See you next time.